Okay. Kalimera and good morning, everyone.
Salom.
Very happy to be here this morning. A little less happy that it's digital and virtual. Would have been nice to meet you all physically, but it's okay. I talked to the organizers and we'll do something about it next year, right?
Yes. Monica will provide us with the funding, and then we'll do it. Thank you.
So my name is Liron Freind. I lead what's called an NVIDIA developer relations. Basically, that means, especially in healthcare, I'm in touch with the community here, hospitals, HMOs, everything that has to do with healthcare, and of course, startups. I'll talk a little bit about healthcare and AI this morning, but in a minute before we dive into healthcare, let's talk about AI in general. So I'm sure you know AI is everywhere today. Everything that we do, from the movies and TVs that we watch and get recommendations on Netflix, from shopping online and getting bags that look the same or shirts that look the same, what we want. And of course, we talk to many of our machines today, whether it's our phones or machines everywhere, and they talk back to you. And all this, whether you know it or not, is AI. And we meet it today. How did this all happen? A little bit of history, how we came to this point today in time regarding AI. If we look 20 years back, 25 years back, we see that we started all having PCs at our homes. Eventually that led to the internet, which led to mobile phones, which today we have hundreds of billions of devices that are connected. What does that mean? That throughout this 25-year period, everything that we did was collected. The data that we that basically talks about everything that we've done online is all collected, is all stored, and we have a lot of data today. Mostly it's called big data that we can learn and conclude stuff from. And this, while the data was being collected, drove AI. So AI actually has been around for years. In the 50s, we've had academic research done on artificial intelligence. Machine learning, which is a type of artificial intelligence, became very popular in the 80s and 90s, where we were able to write smart algorithms that would use this data and this big data in order to write algorithms that would tell the computer what to do. So a good example of machine learning would be spam. We all have in our Outlook abilities to automatically find spamming. This would be a good example of machine learning. What recently happened, which is basically in the past 10 years, is another breakthrough, a type of artificial intelligence and machine learning, but that's called deep learning. And deep learning is, instead of writing smart algorithms like machine learning, in deep learning, we have, for lack of a better word, smart models that take the data and learn from it automatically. Look at machine learning is based a lot of analytics and statistics. What you see here is a lot of examples of what you can do with machine learning. So if we take a look at verticals like retail, we can have supply chain, inventory management, all based on data that's been collected by the certain retail. If we look at automotive, again, we have forecasting, demands, all data that's been collected by automotive companies that learn to do statistics and machine learning on its data in order to better predict. If we take a look at healthcare, in machine learning in healthcare, we can take a lot of the clinical information or the clinical data and start doing algorithms and statistics on this data, and we can improve the clinical care. We can drive operational efficiency in the clinic by knowing, the peak times, the peak hours, the average age of the patients that come into a certain clinic. There's a lot of data that we can use and do classic machine learning algorithms on it in order to improve healthcare. Then comes deep learning. I do want to take a minute to understand how deep learning works, because it's important to understand later what kind of work you can do with it in healthcare. So deep learning is classic for images. Today, it's much more than just images, but we'll talk about it in a second. The way deep learning works, over here you have an example of a model that has to learn faces and to recognize faces. So what would happen in this model is that it would be fed a lot of faces, hundreds of faces, and all these circular representations are representations of mathematical calculations that this model does on its own in order to learn the faces and to be able to recognize it eventually. If you look at the right corner, what you see is explanation on this network. So what this network is trying to do is trying to identify the faces. It's been fed 100 million images, 100 million faces. Network architecture is a little bit about the way the network is shaped. And eventually what this network will do is after it learns all the faces that it was given, it'll do face recognition. It will recognize the person that it's supposed to see. So that was the beginning of deep learning. Deep learning was really good at images, learning images. It would get fed a lot of images and know to learn from those images and know to come to conclusions. The past 10 years, we've seen a lot of research being done on deep learning. And eventually today, we're able to load all kinds of data into these models. It could be images, it could be video, it could be text, it could be sounds. And these really smart models will know to recognize and will know to do certain tasks that we tell them to do with all this data. So tasks can be classification, it could be recognition, it could be sequence prediction. Whatever task you want deep learning to do eventually, you teach it to do through the data, and then you implement it to do through new data that you introduce to it. That kind of summarizes the differences between machine learning, which is regular statistical data, and deep learning, which is smart algorithms that basically learn by themselves through being fed a lot of data. So as you can see, data is very, very, very important. I'm not going to go too much into details with this slide, but I think it's important that you understand it's not enough just to have this data. A lot of work goes into cleaning and getting the data ready for these algorithms to learn through it. So it's important to understand that once you collect the data, there's a lot of work that has to be done through exploration, cleaning the data, analyzing the data, annotating the data, labeling the data, a lot of work on the data. And then comes the part where the models, whether they're machine learning models or deep learning models, receives the data and start learning from it. So in order for an AI revolution to happen, we talked about the big data that's been collected. Here you have a bunch of examples of how much data is being collected per day in some of the most popular applications that we use today. We talked about our better algorithms, right? We have the machine learning statistical algorithms and we have the deep learning models. And the last part of this AI revolution is the computation power, the GPUs. This is where the company I work for, NVIDIA, comes in. So NVIDIA was the maker of the GPU. NVIDIA actually started as a computer graphics company back in the 90s and the early 2000s. Most of it was concentrated on making GPUs for computer graphics. So if any of you are gamers and play with Fortnite and play with all these popular video games today, you might know NVIDIA actually as a gaming company. But what happened was actually about 10 years ago, the academic researcher in Canada took the GPU and said, okay, I've been investigating AI and deep learning algorithms for so many years. We've been running it on CPU. CPU is a great processor, but it does its processing one after the other, consequence in sequence. And the GPU basically does all the calculations in parallel. Maybe if I take the GPU and put it with my model in big data, it'll run faster. And that's exactly what happened. He took the GPU, he took the big data, he took the model that he wrote, and that's what we call the big bang of AI, the ability to take data and models and be able to execute really, really quickly. NVIDIA saw that happening and said, okay, we're a graphics company, but let's also become an AI company. And today, NVIDIA leads AI research, and basically everyone and anyone who does deep learning today will do it on top of NVIDIA. And what NVIDIA did the past 10 years is create an ecosystem for all these data scientists who are developing and researching AI. So what you see on the bottom layer is basically the NVIDIA family of all types of GPUs that can be used for the research, but on top of it, we've released a lot of software in order for the data scientists to use. The software can be deep learning software. It can also be vertical software. So for example, in the top layer in healthcare, we've released a lot of software in order to go and speed up, either optimize your models, speed up your data collection time. We have an annotation tool. We have a genomics tool. I'm not going to go into the specifics because we're talking about AI and healthcare in general, but basically what NVIDIA did is per vertical, they released software and general deep learning software in order to help either speed up development time, optimize the models, or speed up inferencing time, implementing these models. Deep learning in healthcare. Basically, the question that needs to be asked is how we can help the doctors. What are the doctors stuck on in order to help them with deep learning algorithms? And what you see here is basically general areas within the clinic and within healthcare that deep learning is really good at helping. So radiology, of course, anything that has to do with medical imaging, deep learning is here to help. It can help diagnose. It can help treat. It can help the doctors work in a much better pace. It can help doctors statistically know what's going on with their patients. We've collected a lot of EHRs and EMRs over the past few years, and there's a lot of statistical machine learning algorithms that you can run on these EHRs and EMRs and come up with conclusions to help the clinic. We talked about it before. Anything that has to do with genomic sequencing and genomic analyzing, deep learning is really, really good at, and AI is really, really good at. Of course, drug discovery. We all see COVID and what's been happening in COVID, and the fact that we're able to talk about vaccines in such a short time, that's all been really helped by AI. And of course, anything that has to do with personal medication, the ability to let the doctor have a much better personal interaction with the patients through deep learning, through the ability to give him the statistics, give him the flags that he needs to watch out for, anything that can pop up to the doctor automatically and tell him, watch out for this. We talked about it for a second, radiology, the bread and butter of deep learning. You talked about AI Doc before. We've got a bunch of deep learning startups doing radiology today. It could be early detection, something that the eye doesn't always see, but the AI algorithms knows to see better. It could be diagnosis, helping to diagnose whatever the issue is on the medical imaging better. And it could actually be also treatment. After you have the diagnosis, what type of treatment would best treat whatever that person has? Could be the clinic. We see intelligent devices coming in with AI capabilities. We see digital pathology coming into our lives and being able to find cancers a lot faster through AI algorithms running on pathology. And of course, we have segmentation and classification, which are easy problems for deep learning to solve when it comes to digital imaging. In drug development, we talked about it, we also see a lot of deep learning use cases. Variant calling on the left is something that happens within genomic sequencing, and it's something that takes a long time to do, and through AI been speed up dramatically. High content screening for chemicals through drug discovery and AI, and pathology we talked about. I'll skip these because we talked about a lot of use cases and we're basically out of time. But NVIDIA is collaborating with the world's top hospitals. Here you have an example of Mount Sinai and an algorithm that we collaborated with in order to predict patients' onset of different diseases, running in Mount Sinai today. Two last slides that I do want to talk about. What NVIDIA does is, first of all, it has courses online that you can take. There's a bunch of courses from deep learning fundamentals to NLP to image analysis, everything that you want to learn and know. It's got genomics, by the way. It's got medical imaging for healthcare. So if you guys want to learn online, you can do self-paced courses. And lastly, we also have an Inception program. The Inception program is a startup program. Basically, it's a virtual program for startups running on our GPUs, doing AI. We don't take anything from the startups. It's not something that's time framed. It's basically to help startups use our GPUs the best way and optimize their work the best way so that eventually they'll go to market as much faster. It's a win-win for both. They use our GPUs. We want them to use it the best way possible. And I don't have a slide on it, but just so you know, in October, we have a digital GTC that's going to be happening. You can look up GTC, NVIDIA GTC. It's online. We're going to have a lot of talks. It's spread across US, Europe, and Israel, and a lot of talks around genomics and healthcare and AI. Could be interesting for you guys. Feel free to reach out. This is my email. Like I said, we collaborate with startups, we collaborate with academia, we collaborate with hospitals. The point is to grow the AI community as much as possible and help implement AI solutions wherever we can. Thank you very much for listening.